You know, when I did my rotation through neurology as a medical student and as a neurosurgeon, as a surgeon, the field unfortunately didn't have a lot of good solutions. It seemed like, you know, it was hard to really impact disease, you know, in a significant way. It was kind of depressing, to be honest. And I don't, you know, so how did you get interested in functional medicine from neurology? And I want to talk certainly more about the successes you've been having with the different protocols, the Coimbra and some of these other ones. So how did you go from neurology to having an interest in functional medicine? Was it because you already had a background in physical therapy?
Yes, and I guess that's the reason why I was from the beginning of my medical education. I was interested in all the things besides traditional medicine, because traditional medicine, it's mainly pharmaceutical interventions. Mm-hmm. And if you are trained as a physical therapist, you made the experience from the beginning on that with your hands and with other interventions like sport and stretching and all the stuff and meditating, there you could influence many, many diseases far beyond pharmaceutical interventions. And with this perspective, I got into university, and I was 32 years old. So I was a little older than my colleagues and my co-students. And so maybe I was a little bit more experienced in life, and I questioned everything more than them. And from the beginning on in my neuro training, I still ask questions. And the chief medical, he allowed me to work with my patients in nutritional way, because Rainer and me, we wrote a little paper of the paleo nutrition. And so I could convince my boss that it's science what I'm doing, and to treat neurological patients means they not only have neuro issues, they also have metabolic issues. And so there's no reason why you could not change the diet in neuro patients in a way that he does not need his hypertension medication anymore, for example. Yeah. And so I always tried little interventions. Well, you know, neurological is very conservative. So I couldn't do so many things, but a few I could do, and I did them, and I always was interested beside them. And my doctor father, I wrote my doctoral thesis about lifestyle interventions in multiple sclerosis. So I got very, very deep review of the literature in what could you do in kind of meditation, eating, doing sport, and other interventions. And doing that, I got more and more interested in vitamin D. And then I started in the clinic of neurology to treat patients at least with a few thousand units of vitamin D a day. I guess that was the beginning of my interest of vitamin D. Yeah.
Yeah, I guess we'll just kind of segue into the vitamin D stuff. So this Coimbra protocol is, you know, not a few thousand, but it can be up to 100, 200,000 IUs of vitamin D a day. And that's a huge dose, and people be concerned about calcium metabolism and some of these other things. So could you talk us through that a little bit, and how's it being utilized for things like MS and if there's any other conditions that you seem to have success with?
Yeah, well, as of course I could. I appreciate to talk about this theme, because it's very, very important to get the message out that vitamin D has a use far beyond the average doses. Well, it all starts with a phone call of my doctor father, Professor Spitz. He's very famous here in Germany. He brought all the US scientists, vitamin D scientists to Germany, to Berlin in 2011 to place there the first conference of vitamin D in Germany. And so he's very, very into this theme. And once upon a time, he called me and said, well, there's this crazy guy in Brazil. He's called Coimbra, and he's working with doses far beyond what we are doing here. It's 50,000, 100,000, and 150,000. And I said, stop. That's way too much. I thought at that point that I knew so much about vitamin D that giving a patient doses in these high is crazy and very, very severe, dangerous for patients. So I stopped him and said, well, you could fly to Brazil. You have the money, you have the time. Yeah, you could check out the guy, but I'm out because I consider such high doses, as you said before, as very, very dangerous in the manner of calcium metabolism. So that was my first reaction. So I rejected totally. But after 3 weeks, he came back and he said, well, I have seen really miracle things. I've seen fabulous things. I've seen patients, recover total from their MS, or at least make some very, very serious progress. And so we need to place this therapy in Germany. And as someone who's very, very good in connecting people, he put all it was at least 3 medical doctors who already treat with these high dose protocols, and he brought them together with a few other doctors who are interested. And so we got our first training in the Coimbra protocol by these first 3 doctors who already treated since 2016 in Germany. And that was an amazing time to get my first contact with this kind of therapy. And it was a 3-day training, and it was so convincing to me that I decided that I have to visit one of them to see if this is really working, what they're telling me. And that was my next step after I got this little education. I traveled to Beatrix Schweiger, and she's now my employee and a good friend and colleague. And I stayed in her clinic for a couple of days and treating her patients. So every day I see patients, and it was so convincing what the patients were telling me. Like serious symptoms like ataxia. There was a young guy who had such strong coordinative skills in his mouth that he bites himself while eating, and it was so severe that he was bleeding with every meal. And after a few months with vitamin D, for the first time for many years, he was able to eat without help, without something where a straw where you pull in it, and he could swallow and eat like a normal guy. And he was so relieved. And I've never seen such a progress with medication in 7 years of neurology I stayed in. And these days were such a game changer for me that on the end of this staying, I went back to my clinic and I spoke to my boss, to this chief medical, and I said, I quit. I couldn't stay even one more day in the hospital. At the end, it was three more months, but I quit and started get trained by Beatrix Schweiger with the Coimbra protocol, because I've seen so many MS patients in our clinic deteriorating under the medications, and suddenly we had a treatment. And so I couldn't agree to myself to work anymore with the medications. I needed to try it myself, and I never regret this step. And now for 4.5 years now, I work with Beatrix and with my own patients in different autoimmune conditions, but mainly MS. And I'm making the same experience than years ago with Beatrix, with my patients. And it's a wonderful work. If you see young and older patients get some or very much relief of their symptoms, as you could expect.